name is Jim McLaren. Doing, we'll call it relief work, but I've been here for almost 10 years. My primary responsibility is the medical care of the chimpanzees.
My name is Charlie Mudge. I am a cardiac sonographer, and I've been working in the field for 30 years in human sonography. Most recently, I volunteered at the Project Chimp to be the cardiac sonographer for the chimpanzees evaluations.
My name is Mary Frankus. I am a volunteer at Project Chimps, and I've been volunteering since about 2020. And I used to be a cardiologist, and so I have tried to take some of that training and apply it to some studies that we do with the chimpanzees.
Today we're doing part of what we do, it actually goes all year long because it requires anesthetizing the chimpanzees for physical exams. These are routine exams that we do, and they're on a scheduled basis every 4 years, 5 years, but pretty consistently 4 years. And that they are sedated. When they're sedated, we do not only a physical exam, we do laboratory analysis, we do cardiac workups, including ultrasound and EKG. We do radiographs, we take chest films, we take abdominal films, x-rays of their pelvis and their lower GI tract. As part of a routine, we do laboratory sampling, blood sampling, and we also urinalysis. Physical exams include just literally going from nose to tail. They don't have a tail, but it's just an all-inclusive exam that we do on a regular basis on every one of the chimps.
Today we're looking with ultrasound at the anatomy and physiology of the chimp heart. And we're looking for any pathology that exists there or just the function of the heart in general.
Today's exam was on a chimpanzee named Mooney. So while she was anesthetized, we were able to position her in the correct position to get good images, and that generally is for both humans and chimpanzees, is up on the left side. And so we bring our equipment in close to her. We have an ultrasound probe that we can apply to the surface of her chest. There is some ultrasound gel, and we use that to have good contact with her skin. And it's amazing to me that chimpanzee heart looks so much like a human heart. I don't think I could tell you the difference if somebody just showed me the pictures and didn't tell me if they got it from a human or a chimpanzee. We are very much alike, and so it was easier then for the sonographer who does this actual acquiring of the images, and for myself who does some interpretation of the images. It was easy to make the transition from our training in humans over to the chimpanzee.
I am a registered diagnostic cardiac sonographer, which means I have completed the course of study for heart pathophysiology and anatomy in plain anatomy, namely in doing sonography or ultrasound. I also have got my credentials in vascular ultrasound, which would allow me to look at the arteries and veins inside the chimps' bodies. Today we'll be using ultrasound equipment from a company called Mindray, and we're using a product called Mindray 7, and M7 is one that's designed specifically for this purpose. The M7 has set up exactly for working at the heart and vascular levels. This machine is pretty much state-of-the-art, and it's been donated to us by a company called TTG out of Atlanta, Georgia, who do contract services in cardiology throughout the country. This equipment costs in the $25,000 to $30,000 range of base price. And then we add on the cardiac software and transducers, which brings it up another $15,000. In scanning these chimpanzees, I have found how remarkably similar they are to humans in regard to their anatomy, their physiology, and the only variance is that their diseases or pathophysiology are different, and they're more specific for their lifestyle, and ours is more specific for ours. So these are differences that have been interesting. Well, for instance, humans, the modern human tends to have in general, a lifestyle that contributes towards cardiac disease in the arteries of the artery, or coronary artery disease, which causes serious heart attacks that are not reversible many times. Chimpanzees have a very clean diet as far as the vascular and heart is related, and they also have more exercise available to them, whereas humans just generally are a little bit more sedate.
In working with chimpanzees, we've learned a lot of things. The medical aspect of it is very similar to human medicine. It's very similar to veterinary medicine in the aspect of another living creature. We all have our differences, but we have so many similarities in all species.
On today's exam, we were very pleased to see a nice normal heart for Mooney. Her pumping function of the heart is normal, and her valves all opened and closed normally. The estimated pressure inside her lungs looks normal. So that was very pleasing. It's always nice to see a good, healthy, functioning heart.
Mooney is in her 30s, has had some issues previously with swollen feet, swollen legs that would periodically come and go. So it kind of worked where she was getting a regular physical, and we could look at her feet and make sure there weren't any issues. Our concern with her, and as a primary, was with the swelling like that, we were concerned, just like in people and other animals, that she had some heart disease. And if the heart wasn't functioning appropriately, then there would be fluid collecting in some of the extremities, and that was one of the biggest things we wanted to follow through and check out. And all the way back, the physical was great, was all normal. We found no basic abnormalities. The swelling, unfortunately, we determined was mostly fat.
I also looked at some of the vessels that go to her brain, and namely the carotid arteries, and they seem to be very clean also. Well, my all-time favorite part is the close proximity to a chimpanzee. And I've never been able to get this close and intimate with one where I can actually put my hands on and look inside the chimp to see what's going on. And almost equal to that is working with this staff, who are just very dedicated and caring and loving toward these animals. And I just feel like I'm part of the family. Well, we do periodic evaluations of the chimp's health in the clinic. And anytime a chimp would have some symptoms that would require a cardiac look, then we will be available and set up an opportunity to look at the heart and make images, and then submit them to a database so that we can follow the progress or digression of the disease. The availability of this equipment will allow us to get a jump on any anomalies, that there are problems that are going on with these chimps. And in early evaluation detection, we can prevent or treat problems and much more effectively than waiting until the worst case scenario.
By being preemptive, by doing physical exams, we do the best we can under the circumstances of doing physical exams on these animals.
I would like to give a hearty thanks to Thomas Leftwich, who has graciously donated this equipment through TTG, which is the company that it comes from.